Good evening, class. This is going to be a quick lesson on venipuncture on a mannequin. For the purposes of this video, I've already identified my patient. His name is Joe Brown. I've identified him by his bracelet, the doctor's order, his bracelet, his medical record number, his date of birth, and him saying his name. I've washed my hands already. I've donned gloves. I have a gown on. Tonight I'm going to be doing a 3 lab draw, the rainbow set that I explained to you in my PowerPoint slides. It consists of a blue tube, an SST tube with a separator in the bottom, and a CBC tube. The first thing you want to do is you want to explain to your patient that you're going to be drawing 3 tubes of blood and they're going to feel a tiny venipuncture. You put the tourniquet approximately 3 inches above the antecubital space. You want to do this whole process in less than a minute if you can. You're going to wipe the site clean. On the mannequin, the alcohol doesn't dry, but you should let the alcohol dry. You're going to take your needle, you're going to put it into a vacutainer. You're going to have all your supplies set up before you even start. You're going to take your first tube of blood, you're going to slide it into your vacutainer, you're going to insert the needle with the bevel up into the vein. I'm going to take the tubes out. You're going to put the SST tube in. You do that in the middle of the blue and the CBC so that the additive doesn't get in there. After you're done, you're going to take the tourniquet off. You're going to put a 2x2 on the patient's arm. You're going to take your needle guard, you're going to put your needle in the plastic, throw it into the sharps container. You're going to apply a piece of tape. You're going to be talking to the patient, and you're going to ask the patient, are you okay? You feel all right? Make sure that the site isn't swollen or it's bleeding. You're going to come back over, and you're going to label your tubes of blood. You're going to put your CBC on. And as you see, it has Joe Brown, the medical record number, the lab number, his date of birth. You're going to have to date it, time it, and put your initials on it. Put that one over. You're going to do the same thing with your SST. And the same thing with your PT. After you get all done, you're going to put all your tubes in a lab bag. You're going to seal that up. You're going to transport this to the lab. You're going to take your gloves off. You're going to walk back over to the sink, wash your hands. You're going to go out and document the procedure in the chart. Thank you very much. That's a quick venipuncture for you. How's that?